everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. A lot of times I get the question, what age should my child be evaluated by an orthodontist? And I like to see children by about 8 years old. Why 8 years old? Well, most 8-year-olds are not going to require orthodontic treatment. But we like to be able to evaluate to see if there are any problems that need to be addressed early when plenty of growth remains. So usually there are 3 reasons why we'll do early treatment. One is because sometimes there are problems that affect the growth and the development of the jaws. The second reason is that we want to make sure that all of the permanent teeth can come in safely. And the third reason is that we want to make sure that there's space for all the permanent teeth to come in, that we aren't required to do extractions later on. So I'm going to show you a case. This is Sarah, and Sarah came into my office just for a standard orthodontic evaluation. She was not referred to us by anybody. Just the parents decided to bring her in and see if anything was necessary. And there was a problem with the way that the permanent teeth were coming in that really needed to be addressed early. So let me show you what that problem is. Okay, this is Sarah, and Sarah came to us because she and her mom were concerned about the spaces between her front teeth. Yes, she had spaces between her front teeth, but I didn't feel that she was ready for orthodontic treatment at this time because she still had 7 baby teeth present. There were 2 on the bottom and then 5 on top. 1, 2, 3, 4, 5. So I would have preferred to have waited to treat Sarah, but there was something that really alarmed me on this x-ray, and it was the position of these 2 teeth. These are the upper permanent canine teeth, and they really belong right here and right here. And of all the permanent teeth in the mouth, if there's a tooth that loses its way coming in, it's these upper permanent canines. When they lose their way, they most often lose their way by coming towards the upper front teeth or the upper incisors. And in some rare cases, they can actually come so far towards the middle that they do damage to these upper front teeth, and they'll start wiping away the roots of the upper front teeth. In fact, I saw a little girl who came a few years too late, and so much damage had been done to her upper front teeth that they could no longer be salvaged and they had to be removed. So that's what we're trying to avoid for Sarah. That's what we're trying to avoid for many cases that we see like this. And this was something that they were unaware of. So typically when we do this, we get the help of an oral surgeon. The oral surgeon will attach a little gold chain onto these teeth, and then my job as the orthodontist is to guide those teeth just gently, link by link, into the mouth. So we added a few braces on Sarah's teeth, and then we added a little appliance that would help us get the right direction of pull. So if you want to see what that looks like, here is an x-ray of us in the progress of bringing these teeth in, and you can see the little gold chains showing up on the x-ray. I'm going to show you a picture of things mid-treatment so that you have an idea about what this looks like. So you'll notice there's 4 braces on the front teeth. We actually already have one of the canine teeth already in over on this side, and we're still waiting on this one to come in. You don't see the gold chain present anymore because the gold chain actually came off in this case, but luckily it came off when we already knew that things were in a good position. So once again, this is how Sarah's front teeth started. This is how they finished. You can see that we have some nice alignment of the teeth, and we have 1 canine tooth already in on this side, and the other one is just poking through on this side. So we accomplished our goal of phase 1 treatment. In Sarah's case, we brought the upper canine teeth in safely. There was no damage done to the upper incisors, which is fantastic. And Sarah is now ready for phase 2 treatment. In phase 2 treatment, our treatment goals will be to try to get the bite correct, to try to get all of our alignment corrected, and to try to get a beautiful smile that Sarah will love.